So welcome back again to the 13th Annual Air Quality and Health Workshop here in Vancouver at the Sheraton Wall Center in Vancouver. My name is Chris and I'm with the Lung Association, and sitting with me right now is Dr. Jennifer Weuve. She's the Associate Professor of Medicine at Rush University, and she's here to give us a talk on cognitive decline and dementia. So let's get right to it. What is cognitive decline?
So cognitive decline is related to dementia, and let me just explain what we mean by dementia. We say that someone has dementia when their memory function and other mental functions have deteriorated to a point that it interferes with their lives. And most cases of dementia are preceded by several years, maybe decades, of decline in cognitive function. So this relationship is really important. Of course, for the person who has cognitive decline, it's important, even if it doesn't reach the point of dementia, because it can be very frustrating. It can interfere with their ability to live their lives as they have in the past.
Absolutely.
And then there are two other reasons cognitive decline is important, and one of them is how we think about intervening and preventing dementia.
Okay.
So you may know this, there are some drugs that can be prescribed for dementia, but they don't actually work. They sort of treat the symptoms a little bit, but ultimately they don't alter the course of the disease. And so now that the thinking is that if we're going to be effective in treating dementia, we have to start earlier, such as when cognition is declining, before it gets so bad that we would call a person demented. And this extends to prevention as well, which is that if we think about ways to prevent dementia, we might want to think about how to slow cognitive decline. And so this has been a really important target of our research.
Wow, that's really interesting. But what about its effects with air pollution?
Yeah, sure. So it does seem plausible that exposure to air pollution could affect cognitive decline and dementia risk. And there are two reasons we think that. One is that cardiovascular disease and stroke are related to dementia risk and cognitive decline. And certainly air pollution increases the risks of cardiovascular disease and stroke. And then there are two other things that we've learned from animal research. And one is that some air pollutants can get into the brain. And that might happen through the air pollutants getting into the bloodstream and circulating to the brain.
Right.
But also it seems that some pollutants can get into the brain through the nose, by traveling into the nose, up the olfactory tract, and into the brain. And so it's a little bit striking. We don't know that this is the case in humans, but we have observed this in animals. And the other thing that animal studies tell us is that long-term exposure is probably key, more than these sort of bursts of high exposure days.
Is there a specific type of air pollution that really affects it more?
We don't know that yet. There have now been several studies of air pollution exposure and cognitive decline, dementia, and other related outcomes. And thus far, most of those studies have evaluated PM 2.5 and traffic-related air pollution. And there does seem to be adverse associations in those studies. But there hasn't been this sort of head-to-head comparison that we'd like to see, and that has been done with respect to many other outcomes, cardiopulmonary outcomes, for example. So that's certainly an area where the research needs to expand in the future.
Right. You sort of touched on this already, but is there a difference between the recent exposure versus maybe like a long-term exposure to the air pollution?
Yeah, most studies in humans have evaluated exposures extending at least over a year. Many, I think the longest term exposures evaluated has been about 14 to 20 years. And a few studies have compared those long-term exposures with associations with short-term exposures, like a month. And the action really does seem to be with respect to longer-term exposure.
Okay, well, what about Alzheimer's? I mean, that's the one everyone sort of knows about.
Right,
What about Alzheimer's?
So Alzheimer's is the most common cause of dementia. I mean, you could have dementia for many reasons, but Alzheimer's is the #1 cause, and it's characterized by three things. Plaques between the neurons in the brain and tangles within the neurons in the brain, and then ultimately the death of neurons, especially in the area of the brain that's responsible for memory and learning. And so We think about Alzheimer's, and it's important because of our aging population. We expect the number of people with Alzheimer's dementia to triple by 2050,
Wow.
unless we do something to alter the course of the disease, which brings us back to cognitive decline. If we could slow the pace of cognitive decline, many people will have this, they'll have dementia for either fewer years of their lives, or they'll die before they even get it, hopefully at a very old age.
Yes.
I think if we get rid of air pollution, of course they won't.
Well, we've brought that full circle in a very broad way back to, of course, cognitive decline and dementia. That is unfortunately all the time we have right now, but we have all her slides from her deck, from her presentation on cognitive decline and dementia on our website, and we want to thank Dr. Jennifer Weuve for taking the time for doing this with us. And that's it for now. Thanks, guys.
Thanks.